There are several intermediate, non-flow limiting lesions in this patient's left anterior descending coronary artery, and geographically, they are quite similar. Is one or more of these lesions lipid-rich? Near-infrared spectroscopy is a well-established analytical tool frequently used to evaluate chemical composition of unknown substances. Infraredics has developed a novel system that can perform near-infrared imaging of the coronary arteries in patients undergoing cardiac catheterization. Let's examine this new approach to imaging of plaques. The Infraredics catheter is positioned distal to the lesion over a guide wire. As the inner optical core of the catheter rotates rapidly, a pullback is performed. Near-infrared laser light is directed at the vessel wall. Some light rays are deflected by red blood cells and do not reach the lesion. Light reflected from the lesion is detected by a sensor. This generates a near-infrared spectrum. Each spectrum provides data on the chemical content of a single small area of vessel wall. 40 spectra are acquired per second as the catheter scans the entire vessel. The spectra are analyzed using an algorithm validated in autopsy specimens that indicates the chemical composition of the plaque. The algorithm will be trained to indicate the probability of lipid-rich plaque at each pixel, and a chemogram will be generated. When the algorithm research is concluded, the chemogram will provide a detailed map of the presence or absence of lipid-rich plaque in the arterial segment that was examined. The chemogram in this hypothetical example indicates that the distal lesion is lipid-rich. The proximal lesion, however, does not appear to be lipid-rich. Ongoing research studies in perfused human coronary artery autopsy specimens indicate that near-infrared spectroscopy has the potential to differentiate lipid-rich plaques from fibrotic plaques. Clinical research studies are underway to determine the ability of the Infraredics system to determine the chemical composition of plaques in patients undergoing cardiac catheterization.